Our bodies are incredible machines, constantly working to keep us alive and functioning. Every second, countless processes are happening inside us, from the beating of our hearts to the firing of neurons in our brains. These processes require a constant supply of energy. Just like a car needs gasoline to run smoothly, our cells need fuel to operate efficiently. Without this fuel, our bodies would come to a standstill, much like a car without gas. This essential fuel comes from the food we eat. One of the most basic and vital forms of energy our body uses is glucose, a type of sugar. Glucose is a simple sugar that is a primary source of energy for our cells. When we consume carbohydrates like fruits, vegetables, and grains, our digestive system breaks them down into glucose. This process begins in the mouth and continues through the stomach and intestines, ensuring that glucose is readily available for absorption. Once broken down, glucose enters our bloodstream and travels to our cells. Here it undergoes a series of chemical reactions known as cellular respiration. This process converts glucose into adenosine triphosphate, ATP, the energy currency of the cell. This energy powers everything we do, from the most basic functions like breathing and thinking to more complex activities like running and jumping. Every movement, thought, and breath relies on the energy produced from glucose. Without glucose, our cells wouldn't have the energy to perform these essential functions. A lack of glucose can lead to fatigue, confusion, and even more severe health issues. In essence, sugar is like the battery that keeps our bodies running. Just as a battery stores and provides energy, glucose stores and provides the energy our cells need to function. But just like too much gasoline can damage a car engine, too much sugar can have detrimental effects on our health. Excessive sugar intake can lead to weight gain, diabetes, and other metabolic disorders. It's crucial to balance our sugar intake to maintain optimal health. While sugar is essential for our bodies, consuming it in excess can lead to a cascade of health problems. It's not just about the calories. Sugar has a profound impact on our metabolic health. The modern diet is often overloaded with added sugars found in processed foods, sugary drinks, and sweets. These hidden sugars can be found in items you might not expect, like bread, sauces, and even salad dressings. When we consume too much sugar, our bodies can't use it all for energy. This surplus sugar is not just wasted, it has to be processed by our bodies, leading to various metabolic issues. The excess glucose is converted into fat and stored in our bodies, contributing to weight gain and obesity. This is particularly concerning because it can lead to visceral fat, which surrounds our organs and is more dangerous than subcutaneous fat. Over time, this excess fat can lead to insulin resistance, a condition where our cells become less responsive to insulin, a hormone that regulates blood sugar levels. Insulin resistance doesn't just affect blood sugar, it can also lead to increased fat storage and difficulty in losing weight. Insulin resistance is a key factor in the development of type 2 diabetes, a chronic condition that affects millions of people worldwide. Managing this condition often requires significant lifestyle changes, including diet and exercise modifications. Additionally, excessive sugar intake is linked to an increased risk of heart disease, stroke, fatty liver disease, and even some types of cancer. These conditions are serious and can significantly impact one's quality of life, making it crucial to be mindful of sugar consumption. Diabetes mellitus is a group of metabolic disorders characterized by high blood sugar levels over a prolonged period. This occurs when the body doesn't produce enough insulin or cannot effectively use the insulin it produces. There are two main types of diabetes, type 1 and type 2. In type 1 diabetes, the body's immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. This type often develops in childhood or adolescence and requires lifelong insulin therapy. Type 2 diabetes is more common and typically develops in adulthood. It's often linked to lifestyle factors like obesity, physical inactivity, and an unhealthy diet. In this type, the body becomes resistant to insulin or doesn't produce enough to maintain normal blood sugar levels. Uncontrolled diabetes can lead to a range of serious complications, particularly affecting the circulatory and nervous systems. When blood sugar levels remain high over a prolonged period, it can cause significant damage to various parts of the body. This damage is often silent and gradual, making it difficult to detect until it has progressed significantly. One such complication is diabetic neuropathy. which is damage to the nerves in the body, most commonly in the feet and legs. This nerve damage can result from prolonged exposure to high blood sugar levels, which can injure the walls of the tiny blood vessels that nourish the nerves, especially in the lower extremities. Diabetic neuropathy can cause a variety of symptoms, including numbness, tingling, pain, and weakness. These symptoms can vary in intensity and may worsen over time. The loss of sensation can be particularly dangerous, as it can prevent individuals from noticing injuries or infections in their feet. This loss of sensation in the feet makes it difficult to feel injuries, leading to the development of foot ulcers. Foot ulcers are open sores or wounds that occur most commonly on the bottom of the foot. They can develop from minor cuts, blisters, or pressure points that go unnoticed due to the lack of sensation. These ulcers are slow to heal due to poor blood circulation, another complication of diabetes. Poor circulation can result from the narrowing and hardening of the blood vessels, which reduces blood flow to the affected areas. This lack of adequate blood flow means that essential nutrients and oxygen are not delivered efficiently to the wound site, impeding the healing process. High blood sugar levels can damage blood vessels, making them narrow and stiff, restricting blood flow to the extremities. This vascular damage is a key factor in the development of diabetic foot ulcers and other complications. Maintaining good blood sugar control is crucial in preventing these issues. This reduced blood flow hinders the body's ability to heal, making foot ulcers prone to infection and slow to heal. Infections can further complicate the condition, potentially leading to more severe outcomes such as the need for amputation. Regular foot care and monitoring are essential for individuals with diabetes to prevent and manage these complications effectively. Section 5. Gangrene, a dangerous complication. When foot ulcers are left untreated and become severely infected, they can develop into gangrene. Gangrene is a serious condition that occurs when tissue dies due to lack of blood supply. It's a dangerous complication of diabetes and requires immediate medical attention. The affected area may appear black or blue, cold and numb, and have a foul odor. Gangrene can spread rapidly and become life-threatening if not treated promptly. Treatment often involves surgery to remove the dead tissue and strong antibiotics to fight infection. Section 6. Amputation, a life-altering consequence. In severe cases of gangrene or when other treatments fail to heal a diabetic foot ulcer, amputation may be necessary. This involves surgically removing the affected toe, foot, or part of the leg to prevent the spread of infection and save the person's life. Amputation is a life-altering procedure with significant physical and emotional consequences. It can impact mobility, independence, and quality of life. Rehabilitation after amputation is crucial and involves prosthetic fitting, physical therapy, and emotional support. Section 7. Facing mortality, the ultimate risk. Uncontrolled diabetes and its complications, if left untreated, can ultimately lead to death. The high blood sugar levels can damage vital organs like the heart, kidneys, and eyes, increasing the risk of heart attack, stroke, kidney failure, and blindness. People with diabetes are also more susceptible to infections and have a higher risk of developing certain types of cancer. While diabetes itself might not be the direct cause of death, its complications significantly increase the risk of premature mortality. Section 8. Preventing diabetes, taking charge of your health. The good news is that type 2 diabetes is largely preventable through lifestyle modifications. By adopting healthy habits, we can significantly reduce our risk of developing this chronic condition. One of the most important steps is to maintain a healthy weight through a balanced diet and regular exercise. Engage in at least 150 minutes of moderate intensity aerobic activity, or 75 minutes of vigorous intensity aerobic activity per week, along with muscle strengthening activities at least twice a week. Choose water over sugary drinks and limit processed foods, saturated and trans fats, and added sugars. Section 9. Living with diabetes, a beacon of hope. Receiving a diabetes diagnosis can be overwhelming, but it's crucial to remember that it's not a life sentence. With proper management, individuals with diabetes can live long, healthy, and fulfilling lives. This involves working closely with healthcare professionals, monitoring blood sugar levels regularly, taking medications as prescribed, and making healthy lifestyle choices. Remember, You are not alone in this journey. Support groups, diabetes educators, and loved ones can provide invaluable support and guidance. By taking an active role in managing their condition, individuals with diabetes can live their lives to the fullest.